Good afternoon. It's Friday, November the 20th. I'm Alan Van Driel, the Chief Executive Officer at Smith County Memorial Hospital. With me today are Dr. Justin Overmiller, one of our medical staff members, and Sarah Ragsdale, our Chief Nursing Officer at the hospital. As all of you are aware, there's been a rapid increase in the number of positive cases in COVID-19 within the last several weeks, really, in Smith County, and even more so day by day as we go forward. As a result of that, we've had lots of conversations about what we need to do to make some changes within the response in Smith County, and that's what we want to talk about today. As we start, I'm going to have Dr. Overmiller talk just a little bit about the clinical situation that we're dealing with here at the hospital as we treat patients.
You know, we've been dealing with COVID in our community for a while, but certainly not at a heavy level. So we have had 5 cases for a whole bunch of this pandemic, and that's just no longer the case. Our numbers have really risen dramatically within the last month. I'm sure we're over 100 cases at this point. We, I guess, are not just as concerned about the overall case numbers. There are a vast majority of people who are doing well with the virus and end up with flu-like symptoms and do fine. And it's the people that don't do well that we are finding are stretching the hospital system at this point. So we've had quite a few patients in the hospital at this point that have been ill with COVID. They require just a higher level of care than what we typically would keep in our hospital and take care of. The surrounding hospitals that we often would transfer patients to, they are full of patients who also are very sick with COVID. And so we're in this odd time where this is the point where we worried about at the very start of this virus, that we would run into a time when the hospital capacity, the hospital system is just stretched. And that's where we're at. So we're finding it difficult to transfer patients that need a higher level of care to a higher level of care. We are doing our best. Alan, our respiratory therapy department, we have ramped up our capabilities and ability to take care of people, but we're just inching towards a place where we have just been worried about. I don't want to say a breaking point, but just at a point where we are not going to be able to provide care in a typical fashion that we used to. And so we feel like because of that, we need to take some additional measures within our hospital system specifically. We have tried to be fairly cautious as a medical staff at beating all of you over the head with the things that you should or shouldn't do, and we're not necessarily going to do that now, but there are some changes that we feel we need to make within the hospital itself, and so that's what we'd like to talk to you about.
So these changes that we're outlining here today will be effective on Monday, the 23rd, and they include some changes in entrance to the hospital and in visitation rules. Sarah, would you outline the changes in the visitation rules that we're going to implement?
Sure. So starting on Monday, we will have no visitors coming to the ER. So if you have an emergent patient that needs to be seen, please call ahead, especially if it's someone that's having COVID symptoms. Our nurses can direct you on how we will get them into the hospital and get them screened. As far as inpatient visitors, we'll have no visitors visiting patients, with a few exceptions. A caregiver for pediatric patients will be allowed, one caregiver per patient. An OB coach will be allowed for the labor and delivery department. And on a case-by-case basis, family support for end-of-life patients. We still want those inpatients to be able to be connected to their family members. It's important for the healing process. So phone calls are allowed, of course. We have some tablets available for like video conferencing where they can connect by Zoom or by FaceTime. And all of our rooms have windows to the outside so visitors can visit outside and phone conference into the rooms. As far as family practice, specialty clinic, other hospital departments, we would encourage that patients come alone. They can have a driver, of course, and the drivers we would just encourage to stay in their cars.
In addition to the restrictions on visitors, we're changing the access points to the hospital as well. So starting Monday, the main entrance to the hospital will be closed. All staff, visitors, and patients will enter the hospital through the emergency room entrance. As they have been for some time now, everybody who comes in through that emergency room entrance will be screened by a person who's designated just for that purpose inside the emergency room entrance, and you'll answer the series of questions that we've been using for some time, and you'll have your temperature taken. But that's the only entrance that will allow people to come in, is that emergency room entrance. Partly because of that as well, we will be closing our hometown cafe to dine-in dining starting Monday. Carry-out meals will still be available by arrangement. You can call and get a meal, but you will not be able to come into the cafe to pick it up. You'll pick it up there at the emergency room entrance. So between the measures that we're taking with our staff, and we're also requiring, starting Monday, that all visitors to the building, that all people coming into the building wear masks. Between wearing of masks, between limiting visitors and limiting entrances into the building, we're hoping to keep ourselves safer so that we can continue to care for your loved ones in the hospital here as they need care. We hope you understand these changes, and we wish you all a happy Thanksgiving.